Hi, everybody.
Hi.
Welcome back to the Natasha and Debbie Show. I'm Natasha.
I'm Debbie.
Are you?
I am.
Thank God. Because that would have been really weird if you weren't. Anyway, thanks for joining us in watching our video today. We have a very important video to watch and react to. Just really quickly, because we want to get to it as soon as possible, because this is something we both have been wanting to learn for a long time. So, thank you for watching the last video we just did, which was on, that was so much fun.
That was a fun one.
That one was epic. The Secret City of London. If you haven't watched it, please go check it out. As always, please consider subscribing to our channel. We can always, thank you. We can always put out much more content with much more subscribers. We appreciate you guys. We've reached over 500 in just 4.5 weeks of being on YouTube. So
I think we're doing pretty good.
Thanks, guys. We really appreciate it. And please also go to our Facebook page if you want to connect with us on a little bit more of a personal level. Don't get too excited. It's not that personal. I know some of you were expecting to see today's video to be more of a Q&A, a get to know us video.
Right.
But we're holding off on that just for now because, again, what we're about to dive into here in just a second is something that we have been wanting to learn for a long time.
Yes.
And that's about the NHS. So learning about the United Kingdom's healthcare system. This is something we have wanted to learn.
Absolutely.
And I will say this. Now, we've always said we don't want this channel to be political in any way, shape, or form. And I'm not trying to say that this is a political thing. But let's be honest, people make everything political.
Yes. And it can definitely be a hot button.
It can be a hot button topic for sure.
Heated.
Absolutely, Debbie. It's true. And so with this, we aren't going to give our personal opinion on what we think on the political aspects of anything that should be mentioned. Because I'm looking at the screen right now and it's looking like it's going to start off in a very politicalized manner.
Yeah.
So this is not the channel we want to produce. And what I mean by that is the political part of it.
Right.
But we want to learn about the NHS and get to understand it better because we really don't know much about it other than it's free.
That's all we know.
Yeah. So we're going to go through it. Yeah. We're going to go through this, learn what we can. If we have questions, we'll stop and ask and hope that you guys in the comments will please answer our questions. We would discourage any sort of arguments or anything like that, or overly politicalized commentation. So we just hope that you guys will be with us on this learning journey because we can't learn all about the UK if we're not learning all about the UK.
That's right.
So we want to delve into this video, get to it, right? And if there's anything that you want to add in the comments that maybe they missed in the video, because again, we haven't seen it, we don't know anything about it, let us know. Please. And, if we have questions, we'd love it if you give us the correct answer. So we'll find out. You ready to do this thing?
Let's start this journey.
I always click before I'm about to start the video.
Yes.
It's just a little tweak I have. So let's do this. This is how the United Kingdom's healthcare system, I can't see the rest of the title. What does it say? Let me see. How the United Kingdom's healthcare system works. So basically, for dummies. I wish that was the part of this video that was actually the title. So let's do our best here. And are you ready to go?
I'm ready.
Ready. I'm just kidding. I didn't hit the button right.
Super Tuesday came and went, and the Democratic presidential race is narrowing to two very different candidates. Far-left Bernie Sanders and the more moderate Joe Biden. Biden and Sanders have clashed on the best approach to reforming U.S. health care.
Clearly this video is from a year ago.
Sanders wants to get rid of private insurance altogether, while Biden proposes building on the framework left over from Barack Obama's Affordable Care Act.
Bernie says that you have to bring people together and we have to have Medicare for all. But Bernie says, and he says he wrote the damn thing, but he's unwilling to show us what the damn thing's going to cost. The idea middle-class taxes aren't going to go up is just crazy.
What Medicare for All will do is save the average American substantial sums of money.
The U.S. already spends more money on healthcare than...
Did he say what Medicare would do for all? Because that's for seniors.
But he wanted to do Medicare for all.
But that's for seniors. I didn't realize that's what he was running on.
Yeah.
Okay. Again, sorry, not trying to be political, but I just thrown off when he said that because I didn't know he was talking about Medicare. And if you don't know the states, it's for seniors specifically. Let's go back just a little bit.
substantial sums of money.
The US already spends more money on healthcare than any other developed country. There's one country that spends less than half what the US does on healthcare,
That is
and
the
people
UK.
generally don't pay anything out of pocket when they go to the doctor. The United Kingdom. And out of all the healthcare systems we've looked at, the UK appears the most socialist. The government effectively runs the whole thing. Right now, the UK is having its own debate over how to reform the National Health Service. So how does the UK system compare to the US? And what reforms may be coming?
Hold
In
on.
2018,
Hold on. I bet you guys probably don't like being called socialist.
Probably not.
I'm just thinking that maybe not even the accurate word for it. This is just a question I have. That's all. Again, I know that it's already started on the political thing, but it's just a question I have. Again, let's go. Sorry.
The United States spent around $10,500 US on healthcare for each of its residents. The United Kingdom spent around $4,000 US. That means the United Kingdom spends 9.8% of its GDP on healthcare, while the US spends 16.9%. Despite spending less, the United Kingdom manages to have healthier citizens who live longer and are less likely to die in childbirth. In 2017, life expectancy in the UK was 2.7 years higher than in the US, and the UK has roughly 1.5 times fewer deaths that could have been avoided by access to better healthcare. The infant
Can I
mortality
just
rate is
stop for just a second? Because some of these comparison numbers, and I'm not putting down healthcare and all, but it's just our country's a lot larger too, like the population. I don't know if they're equating the entire United Kingdom. I mean, I guess they are if they're
I
saying
would think
UK.
they are.
Then just kidding. I'm sorry. Stop letting me talk. Well, I was just thinking,
Questions.
like, I don't actually know the population of the UK. So,
I don't either, but if you include all the
and is this,
locations of the UK.
when they're saying UK, are they using it correctly? Because as we know in videos we've watched of Great Britain, UK, so are they using it correctly? Is it the entire United Kingdom? Does that include every place?
Mm-hmm. That's a good question.
So we'd love to know the answer to that. Like, so is, the national, or the NHS, is that the same in England as in Scotland, as in Northern Ireland, as in, other places? I'm just curious. I don't know. Again, we're coming from a place of zero knowledge here. Zero. So help us out. Okay, she started saying something about 2018.
lower in the United Kingdom, with 3.9 deaths per 1,000 live births, as opposed to 5.8 in the United States. And the maternal mortality rate in the US is nearly 1.5 times higher than in the United Kingdom. So how is the UK system structured so that it gets these results while spending significantly less than the United States system?
It's a good question.
The National Health Service is a case where the British decided right after World War II that healthcare should be government's job, like paving the streets, putting out fires, running the library, running the parks.
That's T.R. Reid, author of the book The Healing of America. He traveled the world exploring different countries' healthcare systems.
It's a service you get when you need it, and you never get a bill. It's like going to the library. They don't charge you to check out a book.
Key thing about the NHS is it's a risk-sharing system, so everyone pays into it through their tax. If you need to use it, you don't have to pay anything else. So in a sense, it's not free because it's paid out of taxation.
Dr. John Puntis is a pediatrician who recently retired from the NHS. He is also...
Do you have a question about that? I feel like you were about to say something.
No, I don't have a question. I mean, that's what they keep talking about doing here in the States.
That's where
taxing you more money to cover health insurance.
And that's where the big debate gets into.
Yes.
It's like nothing's free. And let's just be honest, it's not. I mean, at least not in America. I can't speak for your countries, but I can speak for America. There's always going to be a place to get us on something. And I'm speaking for America. Please understand that. Doesn't mean that I don't think that healthcare should be a genuine human right. Of course it should.
Yes, absolutely.
It should be a privilege. It should be a right. But I was curious because, I mean, I don't know anything that's actually truly free in life. So, but I don't know what the tax rate is on that. And I hope that they go into that here. But so far, this is quite impressive information. I will rewind that just a tiny bit. 3 minutes already, and we've already learned a lot, haven't you?
Yes?
Yeah. Let's keep going.
John Puntis is a pediatrician who recently retired from the NHS. He is also co-chair of an organization called Keep Our NHS Public. All of his comments are reflective of the organization and not his personal views.
It's a fair system in that the more money you earn, the more tax you pay, and the more you contribute. But there has been discussion about whether tax should be increased to pay for sorting the NHS out in terms of the current deficiencies and problems, and that is controversial. I think a lot of people favour some tax increase, but then there are other people who say, well, maybe the focus should be on companies that don't pay tax and people that aren't paying tax as the first step.
I had a question, and I don't know what it was now. He made a point there that I thought was interesting about the taxes.
Maybe is it like the more you make, the more you have to pay into the healthcare?
Well, yeah, does everybody?
Well, obviously, I mean, your percentage of a higher amount.
Well, I know what I was kind of thinking was just like you have to pay for things somehow. Like you have to be able to pay. I assume the nurses and doctors, kind of like the police and stuff here, are paid by taxpayers' dollars.
Yes.
So I guess is it the same there? And I wonder with the nurses and doctors, you sort of know that? Like,
do people still want to become nurses and doctors?
No, I'm saying do they get paid from the taxpayers that are paying into the NHS?
I would think so, yeah.
Is that where they make their money? And then I wonder, and these are just questions we have. I wonder if the income for doctors and nurses are similar there versus here.
I would think here they make a lot more money, but
I would think so too, because
they get
our healthcare
bills are a lot
system.
more.
They get what?
I said our bills are a lot more. So
But I would hope so. They better, considering how much money goes out to them. So
just questions.
Just questions. Gonna be a lot of questions.
Things to make you calm.
I would call that socialized medicine. Government provides the care. Government pays for the care. It's paid for through taxes. Everybody's covered the same. To me, that sounds like socialized medicine.
The term socialized medicine has become a political football, especially in the United States.
Yep.
The NHS, if that's socialized medicine, it's great. And we hear this term mainly coming from the US, where it's used as for scaremongering. I would say if the NHS is socialised medicine, we like it, and most people are still very, very supportive of the concept of a national health service.
Each of the UK's 4 constituent countries have their own branch of the NHS, so rules differ slightly between them, but all of the branches operate under the purview of the UK Parliament. There are some services that require patients to pay something out of pocket, such as dental, eye care, and certain prescription drugs, but those fees are low compared to the US and vary by NHS branch. By one estimate from a data analytics firm, prescription drugs cost 57% less in the UK than they do in the US. Unlike with other universal healthcare systems that are only publicly funded, the government also runs the NHS. That means doctors that work in public NHS facilities are employees of the government. Most Britons receive their primary care through general practitioners, who are frequently referred to as GPs. They typically act as gatekeepers for secondary care.
The problems that people are experiencing at the moment is it's taking longer to see your general practitioner if you want to see them.
Most GPs are private contractors with the NHS. They don't charge patients for care. Instead, they earn money directly from the National Health Service. Many GPs negotiate contracts with the NHS to determine how much they can charge the government for their services. GPs may fund their own general practice facilities, or they can rent them from the NHS or private companies. One paper from the Journal of the Royal Society of...
Okay, well, I'm just confused. So, general practitioners, which same word we have here, or primary care doctors. So I guess my question is, started off like they just only are government employees for the NHS, but then the whole private thing, private practice thing. So is there, and maybe they'll answer this question, but are there 2 options?
Yeah, I don't know. That wasn't quite clear.
Well, no, they may still
I was
answer.
confused by that too.
Yeah. Because if that's the case, then, I mean, couldn't that almost be a conflict of interest in the sense, though, if you're getting paid by the government, but then you also have your own private practice? That would never be allowed here, though.
No. I mean, maybe you have to choose whether you're private or.
Well, I thought they just said they also rent out space. Let's rewind that just a hair.
Or, I thought.
Did they say or?
I thought they said
I'm going to rewind it just a
or.
little bit to find out because that was a little confusing to me. And then what's the difference? I would assume if there's private practice, then that's not free. Obviously, because it's not part of the NHS.
Right.
These are all assumptions I'm making, but maybe we'll find out.
With the NHS to determine how much they can charge the government for their services. GPs may fund their own general practice facilities, or they can rent them from the NHS or private companies. One paper from the Journal of the Royal Society of Medicine found that GPs face many issues because of how general practices are funded in the UK.
Some GPs, I think increasingly, don't want to take on the running a business aspect of general practice. And so there are lots of GPs who are salaried partners, so they are paid by the practice to come in and work as a GP, but they don't do any of the business side of the stuff.
There's also a private sector in the UK's healthcare system. It's funded from a combination of out-of-pocket payments, private health insurance, and the NHS itself.
The private sector is growing because it's being consciously promoted by government, and the boundaries being blurred.
Well, I think that private health.
So I wonder, like, how many of you in the UK are, I would assume, like, it seems like everybody can use the NHS.
Mm-hmm.
Everyone, right? That's access to everybody, which is awesome. But then I wonder how many people have the private option.
I would think only the people that can afford it.
Right. So I wonder in the comments if you guys, you don't have to say that. That's really personal information. But I was just curious, like, what is the percentage,
Mm-hmm.
I don't know.
And then I bet those private practice prices are still way cheaper than the US.
I don't want, I wonder if they answer that in here. And if they don't in this video, if you guys have any idea, let us know. This is quite interesting.
Mm-hmm. It's a lot. They're answering a lot, but
they are.
there's still
a lot of questions that pop up. Because again, like I said, we are coming from places of zero knowledge here. So let's keep going.
Healthcare has been growing at a very rapid, steady pace in the United Kingdom for the course of several decades. That's going to continue.
That's Niall Gardner. He's the director of the Thatcher Centre for Freedom at the Heritage Foundation.
With regard to the National Health Service, I mean, there's no sign at this stage that the UK will be moving to a different system to the National Health Service. All British parties are committed to the National Health Service. I think that more and more Britons will be opting for private healthcare in the coming years and decades, not least because there are long waiting lists with regard to the National Health Service.
An analysis from the London School of Economics found that in the 2018 to 2019 fiscal year, NHS England spent around 18% of its total expenditure on the independent sector.
There's been a blurring of the boundaries, if you like. For example, cataract surgery, which is the most common operation done under the NHS. Increasingly, it's being provided in the independent sector, and the NHS has contracts with the independent sector to do that work. There are implications in terms of staffing. Private sector doesn't train its own staff, it takes it from the NHS. It cherry picks, takes the low-risk patients, not the high-risk patients. It has an impact on training NHS staff, and this is one of the problems with cataract surgery. If they're all going to the private sector hospitals, then the NHS staff don't become experienced in doing cataract surgery, and then along the line you find it's more difficult to staff your NHS unit. So it's not without negative consequences.
So
we are paying.
Is the people going to then using the private, is it saying private sector? Is that what the wording I want to use here? Is that hurting the NHS then? Those guys, from my understanding, it's hurting the doctors there.
Yeah, so the doctors don't get the training.
But I'm just confused. Did not the doctors all start at the NHS, and then they had to fund their own private sector, their own private practices?
Yeah, but I think he's also saying the private practices will go in and cherry pick which doctors they want, the best of the best, and ask them to come work with them.
So this is not as black and white as I expected it.
Mm-mm.
You too?
Yeah, I mean, it's going in a little bit more in depth and more of the details of it all. The things that you didn't think about,
Yeah.
things to consider.
Yeah, and I really like this guy here. I think he was. Did they say he was a kid? That's the kid doctor word.
Pediatrician.
Pediatrician. That's the kid doctor in America. It's not. But I like him, and he's got a lot to say. I feel that's like, oh, if I could just shut up for 2 minutes, I could get the answer. But I get questions in my head, and I just want to ask, because then I kind of forget. But okay, let's go from here.
Private companies increasingly to do work for the NHS, including American companies, and they're very well established now, particularly in back office functions and providing advice on commissioning support, this kind of thing. They're very involved, and unfortunately that's likely to increase, and it's something which campaigners are extremely worried about.
Okay, so they're not happy about the private.
Really believed that UK voters would decide to Brexit.
The news that the United Kingdom voted to leave the European Union shocked the world. The NHS was a...
Let's just stop right there for a minute, because Brexit? She didn't even hear about this word until I mentioned it to her, last week. Am I right? Mm-hmm. I was like, hey, maybe we should do a video about Brexit. And I laughed, and she's like, what's Brexit? And I'm like, no one knows. I'm sure you guys do. We don't have a clue. So when if they bring this up anymore,
maybe that'll be another video.
I don't know that we could possibly comprehend Brexit. I mean, I know a little bit about it, but about as much as I knew about this, which tells you not much. Let's rewind that a little bit. Let's read the sign. To Brexit, you have destroyed my future career. Yeah. If anyone has a very simple, easy to understand sentence in the comments about Brexit, please. Or maybe a simple video link. Yes. We'd be happy to pay attention to that too. So let me just rewind that back to that spot right there. And please be nice to us in the comments. Again, we are just trying to learn for our own educational reasons. Mm-hmm. We have such an interest in your country and in the kingdom, I should say, that we want to learn as much as we can. So, yeah. Pardon our ignorance, but we are trying to learn, and we can only do that by asking questions and by watching the videos. That's right. So let's continue.
Anyone really believed that UK voters would decide to Brexit.
The news that the United Kingdom voted to leave the European Union shocked the world. The NHS was a big part of the Brexit media discourse, with the Leave campaign famously claiming that the UK would take back £350 million a week that could then be funneled into the NHS. The UK Statistics Authority has since said that the claim is a, quote, clear misuse of official statistics.
My name is Holly Jarman. I'm an assistant professor in the Department of Health Management and Policy at the University of Michigan. Those promises really did hit home for a lot of people. The idea that money would come back from Europe to the UK was a very powerful symbol. It's not actually true. That wasn't really how EU financing works. But we still saw that was a big part of the media discourse and most likely part of people's judgment when they were casting their vote.
The UK officially left the EU 3 years after the original Brexit vote, entering a transitory period through the end of 2020 while the UK government negotiates international trade deals. The concerns about private American corporations engaging more with the NHS came up during the discussion of the post-Brexit trade talks with the United States.
When you're dealing in trade, everything's on the table. So NHS or anything else, or a lot more than that.
Backlash to President Trump's comments on the NHS led to many British politicians assuring their constituents that the NHS was not going to be a part of the trade talks.
The NHS is in no way on the table.
President Trump then backtracked on his comments, saying he wouldn't consider the NHS as part of the trade deal.
A lot of trade negotiations are actually quite secretive by nature. The two sides don't really want to reveal a lot about what they're looking for in a deal. Our concern really as health researchers is that the NHS really won't be accounted for in that deal, that the UK government's preferences have been shown to be largely economic and not so much on focusing on the health of people in Britain.
The problem is that the NHS is already on the table. It has been for a while. The politicians who are now going to be negotiating the trade deals, it's going to be across many fronts. Campaigners were saying, okay, put your money where your mouth is. If you're saying the NHS won't be in a trade deal, then let's see legislation that sets that out so it's cast in stone. And they haven't rushed to do that.
Trade negotiations.
Sorry. I could hear you. I can hear her breathing. What you got?
I think what I'm getting is they're trying to take it from public healthcare and turn it into private.
Which I would assume would be not what y'all want.
No.
It's like kind of ruining the whole point of
They're
it.
kind of going backwards.
Am I right though? I mean, am I correct in that assumption that I would think I'd be correct in that assumption that that would be kind of destroying the whole point of it?
Yeah.
Right?
Yeah.
Yeah.
I
mean, from what I'm hearing and understanding so far, at first I was like, this sounds like a really good idea to have both options, you know? Absolutely, the NHS sounds amazing. And I bet you guys are incredibly proud of this, you know? Like, that's a big deal. And I was originally curious when it started, but I think they did say after World War II.
Yeah.
Which, that's pretty interesting that it's been that long. I knew it was before I was born because I grew up always hearing that over the seas, you know, that was the way it was explained to me, was free healthcare in Canada too. But I would just think that you guys would be very proud of this system. You know, yeah, we don't have free healthcare. Right. Now, having said that, I know we're not done with the video yet. Well, actually, let me come back to that thought. But I just wanted to see what you had to say there on that. At the same time, this is just way more than I expected it to be. So let's go back to it.
Cover everything at once. And it's difficult to tell how they are going to be pushing for the liberalisation of drug regulations and to what extent the Johnson cabinet would actually agree with any changes that would be proposed to the way the UK regulates pharmaceuticals. It's really a central government-led process that's not that democratic and does represent big business, and I think that's why a lot of people get very concerned and anxious around trade agreements.
There are some who say the NHS won't be harmed by Brexit, even in the event a trade deal with the EU isn't reached by the end of the year.
I don't expect that we're going to see huge changes actually in the Brexit era with regard to the National Health Service, and so I think with regard to the NHS, we're not likely to see a significant impact as a result of Brexit. I think the free trade deal will be largely focused upon the service industry, which of course is now the largest part of both the US and British economies.
Whatever effect the trade deals end up having on the UK, reforming the NHS will continue to be a big part of the country's political conversation.
People's support for the NHS in the UK is very strong. There's no other country that when we hosted the Olympics in London, we had nurses jumping on beds, and the NHS was actually a part of that ceremony and a part of that national celebration.
Oh, that's cool.
The UK's NHS is very important in British politics. It's an important symbol of Britishness in that context.
Britishness.
I like that. Britishness.
All right.
Well, that's interesting. That you definitely get that regular healthcare free, and everyone has access to
Absolutely. Yeah. Which again, I think, you know, is something to be very proud of. I would be. Wouldn't you?
Yes, absolutely.
So I feel like there's a lot more to be learned. That was a very short video, you know, explaining such a very big topic, a very big system. I mean, come on. What the heck can you really get through in 13 minutes and some change, you know, on something like that? So that's just basically just not even skimming the surface, really. Sure it didn't cover all but at the same time, what questions do you have? Because I have a couple, and there's like, for example, what is that tiny bug? What do you got?
I guess my big question would be, because I hear like, what's your general wait time to get into doctors? Because you hear that all the time when somebody says, well, they have free healthcare. Oh, but they have long wait times.
Yeah, I've heard a lot of that in Canada, for example. Like, we've had friends from Canada, since we're not all that far from Canada, we're like a few hour drive, that their wait times are kind of high. I've also, like, just from a couple of things I've known about the NHS, which literally were like 2 or 3 things I've heard about in my life, was that, you know, maybe over there in the United Kingdom, it's maybe not as bad as a wait time. And I don't really know much more about that.
I guess too, it would consider I'm what you're having done.
Yeah, that's true.
I mean, like they were talking about
The
with cataracts,
right?
You know, are there doctors available to do it? You know, I'm sure like a gallbladder surgery, that's a lot more
We'll get
urgent.
right in and get right. Yeah,
That's kind of urgent.
Yeah.
You're not going to put that off for
No.
6 weeks. Well, you can wait on that.
Yeah.
I'm sure that would be more urgent. But, you know, maybe like an ACL tear or something.
I waited 3 years for mine, only because I didn't want to get it done. But no, I mean, I just want to just say it again. I've said it a couple times now, but I think you guys should, if you're not, I'm sure you're very proud, but if you're not, you should be, because that's an amazing thing. You know, like they said, they've looked at all the countries around and haven't found a better system. But I do want to say one thing, and I'm not making it, again, we will not talk about our own personal political stuff. That's not what our channel's about. We like our channel to be more of a place where after you've heard all the political stuff and all the virus stuff, which we should all take seriously, this is the place you should come to decompress. So we're not trying to go there. And that's just what we want to do. We want to be the happy place. But sometimes there are going to be videos that are hard topics and things.
Yeah.
And they don't necessarily have to be hard topics, but I know people have a lot of
sensitive areas,
but also pride. And then Americans feel like kind of like, oh, you know, we feel a certain type of way about hearing certain words because they just mean different things though. And that's one thing we've been learning when doing a lot of stuff with the United Kingdom is a word there may mean something different here, or have a different connotation. And I think that's important that we ask you guys to keep in mind about our country. You know, that it may mean the same thing, but there's a different connotation to it,
right?
You know, because we aren't the same country. You know, all of our countries in this world are different, and I think that's awesome. You know, and we don't all want to be the same, but we're all on the same earth together. So we need to be happy and loving with each other. And I think this is awesome. At the same time, I just want to say this, you know, again, I'm not making defense for anything. I'm not making a case for anything. It's just information. But I think a lot of people in other countries believe that we have the absolute worst healthcare system on planet Earth. I'm not going to deny that it's absolutely incredibly expensive, but that's not entirely true either. It depends on your job, the type of healthcare you receive. I have amazing healthcare. And you have pretty daggone close to being just as good, if not better. It's pretty darn good. But we're lucky too that we can do that. Not everybody is. At the same time, I know a lot of people in other countries think that if you have cancer or something here, and I have a family member who just went through cancer. She just got done with her chemotherapy, her radiation. And there are things here, financial assistance, that you can get. People that are, you know, low income, that don't make a lot of money, can have Medicaid. Now, Medicaid is something that you can get that is free healthcare.
Yes.
It is 100% free healthcare. Children in foster care all have free healthcare, Medicaid. So I just think our stuff is no more black and white than your stuff is. But I think a lot of people think, oh, Americans. But yeah, I absolutely believe that it's expensive here. Of course it is. And it shouldn't be. The hospitals make a killing. And
it definitely needs to be some sort of reform. Something needs to work out.
We need a reform here in America. Absolutely. I think every president has in some way tried, but they don't know how to do it. And I honestly don't think in our lifetime we're going to see it happen. So if I ever come to the UK, if we ever come to the UK, when you guys would like to invite us, and we'll just make sure we get injured when we're there, not here. I mean, I'm an accident waiting to happen in every 5 seconds. So, but I just want to say in closing that we respect the crap out of this from what we've just learned about it. But I also don't want people to have different misconceptions about our country, thinking it's so horrible. It's not great.
Not great.
But I guarantee you there are much, much worse places in the world. And we should all be very thankful for what we have.
Yeah. And our system looks pretty, you know.
It's
pretty good.
Yeah. I'm proud of it.
From what we've seen of it. Yeah. Seems pretty good.
And we'll do some more research. And if you guys have some links that, you know, might give us a little bit more of in-depth things that we can watch on our own, we'll gladly take them.
Absolutely.
Yeah. So we really appreciate you guys watching this video. Again, please consider subscribing to our channel. And if you want to go on our Facebook page too, to have a conversation about this further, we'd like to do that with you. Please keep your eye on our Facebook if you're there too. We're going to do a live video this week, possibly in the next 24 hours.
Oh.
She didn't even know that. You know why?
Never know.
You know why I didn't know that? Because I just thought of it. It just... But we hope you guys like our reaction to this. Again, you know, this is something we just learned about. And, you know, I think it's awesome. And I think it's high time that we do something in this country too. But that's as political as we're ever going to get on this channel, I hope. It shouldn't be political.
Don't plan on it.
Well, like I said, it shouldn't be political. It should just be a basic human right.
Yeah.
But I don't want people thinking that in America you get just turned away at the door. You don't.
No.
Okay, that doesn't happen. No one likes misconceptions about their homeland out there, and we just want to clear that up too. Again, not defending or making cases for anything. So please don't take us the wrong way. I am very proud of what I just learned.
Yeah,
and I think you guys should be too, if you're not already, but I'm sure you are. Thanks for watching our channel. As always, I didn't say at the beginning, but we're low budget. We like it that way. We hope that you subscribe and you show YouTube with what you like, your favorite girls.
Yep.
Your favorite,
low budget girls.
Make us your favorite couple. Like we should have a YouTube award ceremony thing, a favorite couple.
There you go.
We want to win. And by the way, if anyone didn't notice, Elvis and Marilyn. We really didn't plan this one. The whole red tank top thing from a few videos back, that was planned. This really wasn't. Guys, thanks so much for watching. Thank you for support.
Thank you.
We appreciate our friends in the United Kingdom so very much. So, and if anyone else is watching from any place else, let us know where you're coming from in the comments. We always like to know where you live.
That's right.
That sounded creepy. Not your address, but like the city and
yes.
She smacked me. That meant shut up. Thanks for watching, guys.
Till next time.